Hi, I'm Dr. Shane Ashline with Oak City Chiropractic, and today I'm going to talk to you about plantar fasciitis. There are four main muscles that affect the plantar fascia. It's the gastroc, the soleus, flexor hallucis longus, and flexor digitorum longus. The two later muscles live deep underneath the soleus and the gastroc, and the soleus lives underneath the gastroc. So we're going to start from the top down. So we'll treat gastroc, then soleus, then the flexor hallucis longus, and then the flexor digitorum longus. The idea here is that the gastroc and the soleus come down, form the Achilles, attach into the heel, and as they become tight, they pull the heel back, which will affect the plantar fascia. The flexor hallucis longus and the flexor digitorum longus come actually down the inside of the ankle, and I'll show you on this foot. They actually come down the inside of the ankle. They don't attach to the heel, but they still come down to the bottom and attach into the forefoot. And when they're tight, they'll also pull and create a shortened area for the plantar fascia itself. I found that if you release those four muscles and then do some work on the actual plantar fascia, the pain itself will dissipate. So we'll start with some ART. We start with the gastroc and the soleus. We're trying to just peel them apart. So I start with the knee bent at 90 degrees, and I'll hold the muscles and force them to lengthen and open up underneath my thumb. And what we're trying to do here is promote glide and slide between the two muscles, and that will reduce the tension that it's placing on the back of the calcaneus right here where that Achilles attaches. So I normally spend about a minute here, somewhere between 12 and 14 reps, loosening those up. And then what we'll do is we'll lengthen the foot down, and I'll place Dr. Jackie's foot on my thigh. And we're going to do the same thing just in this range. So again, trying to peel the gastroc and the soleus apart. And again, I'd probably be here for about 12 to 14 reps. After that, I'll actually slide towards the medial portion. Again, I'll show you on this foot so you can see it a little bit better. Slide into the medial portion of the calf where those deeper muscles live, and I'll lean into them, traction them, and then force them to lengthen. Again, spending 12 to 14 reps trying to open these up. Good, and then we'll have Dr. Jackie flip over onto her back. And then from here, we'll do some reps on the actual plantar fascia itself, which lives from the calcaneus to the ball of the foot. So we'll stick our thumb in, traction, open it up. Again, spending 12 to 14 reps, just trying to get that to loosen up. You can spend less if you feel like it's less. We can do some work on the flexor hallucis brevis, which is right in here, which can also cause a little bit of tension in the foot. And then I like to come over here where the retinaculum is, and that's where the flexor hallucis longus and the flexor digitorum longus come underneath and attach into the bottom foot. And I just make sure that those are free and not getting hung up in that area as well. Again, spending longer than I am right now. And then we do traction on the talus here. So we grab it, give it a little pull, and that's pretty much it. This normally wraps up in about 12 visits, can be 15 visits if you have a typically hard case. If there's no bone spur, it's definitely fixable. If there's a bone spur, then we talk about that.